Hello everybody. Hopefully you can hear me or see me. I think we're going to get started in the next few minutes. So give you a chance to get ready and organised and all your screen and everything set up. Just a reminder to mute if you could, just so that we don't get background noise. That would be great. I'm Helen, by the way, and I'm excited that you're joining me on the Infant CPR tonight. So I make it 6 o'clock, so I think we'll get started. There might be a few more people joining. Can you just do me a thumbs up or something to make sure that you can hear me and see me okay? Or put a note in the chat box or something. So great. Yeah, it's kind of weird doing this class virtually, but I'm happy that we can do it, and I'm really happy that you can join. So you can put questions in the chat box, and if I don't get around to doing them, it's just me on my kitchen table. I will get back to you, via email. I will be sending you some class handouts and a couple of video links. And if you really want, you can have this this video link as well. So let me introduce myself. My name is Helen Bagshaw. I work at Winona Health. I'm a critical care nurse, and I've been teaching CPR for about 10 years or so. I go out to businesses, I teach doctors and nurses, but what I really love to do is to come out into the community, because what you do in those first few minutes when something happens can really make a difference. I am a mother. I have got 4 children. I have twins. I'm also grandmother. Sounds really old when you say grandmother. A granny, a nana. My grandkids are 9 months and 7 months. So it's kind of really interesting doing this again for parents, because my own daughters said that so many things in our community have been closed or stopped or not be able to meet. So even though this isn't the greatest way to teach CPR, I feel like whatever tools we can use is better than doing nothing. So plan for tonight is I'm going to teach you a little bit about adult CPR, just hands-only adult CPR, a little bit about child CPR, really going to concentrate on infant and choking emergencies. And if we have time at the end, I'd like to just show you an AED and maybe talk about that. So I'm going to start off with talking about heart disease. I'm not sure why my video keeps going off, but we'll make it work. So we know that heart disease is the #1 cause of death, not just in the world, in the USA. So we can't look after our babies and children if we can't look after ourselves. So the American Heart Association has a simple 7 to help us kind of maybe prevent heart disease. So just want to share those with you. And a great time, New Year, to maybe think about some resolutions or taking some of these simple 7 steps for prevention of heart disease. So the first one is healthy weight. So you can Google BMI and you can put in your height and weight, and you can see that you should roughly be between 18 and 25 for your BMI. Physical activity, maybe try and do 30 minutes 5 days a week. And that's hard when you're a new parent or you work full time or you're tied to your computer. So taking stairs or taking a walk around the lake, trying to exercise as you can. Blood pressure is another one. Get that checked if you can. Also looking at your blood cholesterol. So if you have health insurance and the health provider says, do you want your cholesterol checked? And you say, no, I'm only 30 or I'm only 20 or, oh, I don't need it checking. Yeah, absolutely get it checked. We're seeing patients with high cholesterol in their 30s, 40s and 50s. Well, when we can do something about it, and it doesn't always involve medication. So other one, blood sugar checked, healthy diet. And then the last thing, and probably the hardest thing, is smoking. It's the #1 cause of heart disease. And even though cigarette smoking has gone down, unfortunately, vaping and flavored tobacco is on the increase, especially with our youth. Nicotine is the most addictive drug known, more than alcohol, barbiturates, all those sort of things. So it's a tough call. So get some help, and if you can give up smoking, it's never too late. So just going on to why should we learn CPR? Only about 38% of Americans know how or have received CPR training. So that's kind of disappointing. But good thing is that 40 states in the US now have mandatory CPR for high school seniors. So in other words, you have to have had some CPR training to graduate. So that's good news. And that happens in Wisconsin, Minnesota and Iowa. Another reason why you should learn CPR is because if you're in Target tomorrow and somebody goes down and you're in the shampoo aisle and you see a person go down and you say, I can be a great citizen, I can call 911, but I don't want to do anything. If that person's heart has stopped, then they've probably got a 10% chance of survival by the time the EMTs come. But if you say, well, I'll call 911 and I will start hands-only CPR, and maybe I'll use an AED if they've got one or if one arrives, then you're tripling the chance of survival. And I think that's really important in COVID times. You know, we focus on the mouth-to-mouth part when really the most important part of CPR is the compressions. Also, you know, you think that CPR is stuff that's done in the hospital and you're probably never ever going to see it, and you're not a medical person, and why should I don't hang out with old people, or you just think it's never going to happen. But we know from stats that 70% of sudden cardiac arrest, that's when your heart was beating and it stops, happens at home. So you're more likely to do CPR on a loved one, a friend, a colleague, than nurses are at the hospital. So, you know, great skill to have, great skill to pass on to your family and friends. Really simple for hands-only CPR. You know, the main thing is to always call 911, and the other thing is to start those chest compressions as soon as possible. As we said before, it triples the chance of survival. So why don't people want to learn CPR? Why are people afraid or frightened or worried? When the American Heart did investigations or research, they found that the thing that put most people off from, you know, going to do compressions was the mouth-to-mouth part. And I've just told you that as bystanders, we don't need to do the mouth-to-mouth. The most important part of CPR is the compressions, chest compressions. So until we get a mask, until you know, the paramedics come, doing compressions is the best possible thing you can do. The other thing that puts people off is, well, what if I do compressions and I hurt someone? So if you are doing compressions on a person who hasn't got a pulse and isn't breathing, then they're dead. So you can't make dead worse. Whatever you do is better than doing nothing. And for every minute that we don't do something when the heart has stopped, the chances of survival are reduced by 10%. So if you're kind of putting all that in your head, that means after 10 minutes, they're dead. And we can do amazing things at the hospital. We've got Mayo, we've got Gunderson, we have Winona Health. We can do things when patients get to the hospital, but we can't do anything with a person who isn't breathing and hasn't got a pulse and is dead. Other thing that people worry about is legal consequences. We're all protected by the Good Samaritan law in all 50 states. So nobody has ever been sued for doing suppressions or using an AD. In fact, you probably know Winona Daily News. You'll be an inspiration. You'll be amazing. And if it was my loved one and you had the courage and confidence to start CPR and they didn't make it, then I would find comfort that you did something rather than doing nothing or just calling 911. So I don't know why this is going off, but we'll carry it on through. It's just a challenge. Other things people worry about is I can't do it properly. I don't know how to do it. I've never been trained. I don't know anatomy and physiology. Which side is the heart on? I don't know if I could do it. I'm going to teach you really easily tonight how to do CPR. It's going to be a thing you can show your family, your friends. And I teach 8th graders how to do CPR, and they're on it. They can do it. You know, they're able to you know, follow and take up CPR. So anybody can do it, and everybody should. Hopefully we'll get the video right. There we go. Also, sometimes we might not be able to do it because we shake or we're physically unable, or maybe, you know, if you see any kind of blood or, you know, anything like that. Even if you can't do the CPR, you could show somebody else how to do it. You could be the person who calls 911. You could be the person who encourages, you know, that person to do the CPR. You could be the person who waits at the door at Target to show the paramedics what's happened and where the person is. So there's always something that you can do to, even if you couldn't actually do the CPR. So saying all that, that might make you feel a little bit more confident and want to learn. Teach 8th graders how to learn, how to do CPR, and you know, it's never too young. They say that even at the age of 9, you can do some CPR. You can learn how to call 911. So great to share with your family and kids. So let's get down to it. I'll show you a little bit of adult CPR, and then we'll go on to the infant. I know you haven't got a mannequin there, and I wish we were in the class, and it would be so much more fun, and I wouldn't be stressed out by all the technology on and off. But we'll make it work. So don't all go rushing off, but I have a toilet roll and a t-shirt, and you can put your toilet roll and t-shirt, and you can use it as a way of practicing CPR with your family. So you just put it over, put the t-shirt through the toilet paper, and then you can practice doing CPR, and that gives you a kind of an idea, and it's the closest thing that we've got if you haven't got a mannequin. But of course I do have one here, and here is my mannequin. Hopefully you can kind of see. I'm kind of nervous with the computer the way it's all going, but we'll so when we're doing CPR, we talked about, we see somebody perhaps walking the lake and suddenly they're down on the ground. Our first thing is always going to check the scene to make sure it's safe, because we can't help somebody if we put ourselves in danger. So first thing we do is check the scene. Second thing is to check the person. And the best way to check for responsiveness is by tapping the shoulders. And I know some of you have done this before, so it might be just revision. Hey, are you okay? Are you all right? If somebody doesn't respond to you, that's a medical emergency. So you don't need to know why or what's happened. You just need to know that this person isn't responsive. They kind of look a funny colour. They're not moving, speaking. Boy, I don't even know if they're breathing. So as soon as you see somebody unresponsive, and that goes for a child and an infant, then you need to do something, and you need to do it quickly. So the first thing would be, call for help. So if you were walking the lake and there were other walkers around, you'd say, help, this person's on the ground, they're unresponsive. You with the blue fleece on, call 911. He's unresponsive, we need help here. Second thing, go back to your person on the ground, just give them a quick look. If they're, are they breathing, are they not? If you're a trained person and you check pulses every day, do it. But as bystanders, we're just going to waste time. And, if I ask you lot right now, can you feel for your own pulse? Yeah, I think so. It's a skill. If you don't know how to do it, you would just waste time and worry. So if they unresponsive, they funny colour, they're not moving, it's better to give somebody compressions who doesn't need them than not to do anything at all. And if this person went to the ground and they're high, drunk, having a joke, sleeping, fainted, and you start doing compressions, what do you think is going to happen? They're going to wake up, they're going to move, they're going to push you away, they're going to say, ow, what, heck, get off me. They're going to respond. So really important that you do the compressions as soon as you can. And I've told you the main part of CPR is the compressions. So you can't do compressions through a big coat, a fleece. You do need to locate the landmarks. And you don't need to know anatomy and physiology. But you do need to be able to find those landmarks. So I'm going to show you how to do that when my video comes back on. Okay, so if you all kind of feel here, you've got that hard chest bone, that sternum. If you keep going lower, you've got the squishy bit. We want to do CPR on the lower half of the chest bone. So it doesn't matter if you're male, female, you've got boobs or no boobs, then you are not looking, you need to do CPR right there on that lower half of the sternum. So, you can do it through thinner clothing, but when we use the AED, it has to be skin to skin. So you don't need to take bras and nipple rings off and, I don't know, but you do need to make space or be able to feel those landmarks. So you've done it before, you watch Grey's Anatomy, you kind of got a rough idea. Lower half of the chest plate, you're going to put your palm of your hand on there, you put your other hand over, and then you're going to start those compressions. We need to go down about 1.5 inches, which is the width of a credit card. So, that's going some. That isn't just a little, that is a hard and a fast push. It's hard work. You're going to go at least 100 to 120 compressions a minute. So that isn't 1 Mississippi, 2 Mississippi. It's 1 and 2 and 3 and 4 and 5. And we have to keep going with those compressions. It's hands only. We're not worried about the mouth. We're just doing the compressions. So there's our lady walking the lake. She went down. The guy in the blue fleece has called 911. You started the compressions. You're going to keep going with those compressions until somebody taps you on the shoulder. I'm a nurse, I'm a doctor, I'm a first aider, I can help you. Until the person moves, coughs, makes a noise, tries to take your hands away, all of those things, until the EMTs arrive, until you're too tired to continue and you need other people, even after 2 minutes. If you're got big guns and you're a 20-year-old, you're still going to tire after 2 minutes. So the more people that know, the better the CPR is going to be, so you can rotate. How do you feel about doing the hands-only CPR? Yeah, it's doable, isn't it, right? And we can do the hands-only CPR on a child and an adult. When we talk about the infant, we would want to do the breaths, and I'll explain that why in a few minutes. So with the hands-only CPR, you know, maybe you're at home and you're at a party and somebody on the deck goes down. The first thing you're always going to do is check the scene. Second thing, check your patient. They might have slipped, they might just fancy a lie down, they're sleepy, whatever. Then you are going to check them. Hey, sir, are you okay? Hey, are you all right? If they respond, yeah, but I feel a bit, ooh, then, you know, you're going to have to either call 911 to come and check them out if they're having chest pain or something like that, or, you know, let them, you know, review a bit, and make them sit up, or, you know, encourage them to cough or take some deep breaths or something like that. But if they're totally unresponsive, they look a funny color, they're not moving, that's a medical emergency, and you need to tell somebody to call 911. If you're on your own and there's nobody around, and you've got your cell phone, you can call 911 and put it on speaker, and the dispatcher will know your location, will be able to talk you through what you need to do if your brain goes to mush and you can't think about hands only. So they'll talk you through it. If you're completely on your own and you haven't got your cell phone, you're in the boundary waters, there's nobody coming, then do the CPR, or it's always worth doing something. It's better to do something than to do nothing. So, but you're here with somebody else, they call in 911, you go back to your person, they're still unresponsive, you can't see any movement, then you start those compressions on the same line as the nipples, on the lower half of the chest plate, then you're going to start those compressions hard and fast, allowing that recoil so those coronary arteries will open and feed oxygen to those vital organs, the brain and the rest of the body. CPR doesn't restart the heart, it just pumps the blood. Those compressions just pump the blood around the body until, you know, the paramedics arrive or the AD arrives, and you're only managing those first few minutes as a bystander. So great, we've done the hands-only CPR. Hope that was helpful for you. Now we're going to do the infant, because that's what you signed up, and I'm glad that you're interested. So we said with an adult, you know, if an adult's heart stops, it's usually because of a few reasons, and I can share those with you. So they might be because of drowning, they could be because of a heart attack, could be because of drug use, electrocution, that word, major blood loss, allergic reaction. You know, there's a lot of reasons why an adult's heart might stop. You know, the main one being heart disease, and you know, you've heard the word fibrillation, where, you know, the heart's quivering and it's not pumping, and that's why their heart stopped. But with an infant, do you think infants' coronary arteries are full of pizza, beer, smoking? No, infants are really healthy, and I don't want you to worry, or you know, is this going to happen to my baby? Absolutely not. You're learning this so that, you know, you can, kind of like when you learn fire codes and you learn stuff like that, that it's probably never going to happen, but if ever it did, you've got the tools and you can do something. So, you know, babies are really healthy, and if their heart should stop, it's usually because of something respiratory, something to do with their breathing. And I said that, you know, the number one reason why a baby's heart would stop might be because of choking, and we're going to cover that. So other things that might cause a sudden cardiac arrest, you know, and by that I mean no pulse, no breathing, you know, their heart isn't beating. Could be a traumatic injury or an accident. So I'm thinking of maybe a motor vehicle accident where a baby wasn't strapped in, or drowning, or electrocution, or a blow to the chest. You know, maybe they were on a bouncer or a tabletop, and you know they fell off. Some kind of congenital heart disease, which would be really unusual, given it's so rare, and that those sort of things are picked up in scans, you know, well before the babies are even born, so they're ready and treatable. And the last thing, which the numbers have really declined because we know so much more about it, is sudden infant death syndrome. And that's why we nurse our babies on their back rather than their front. So those might be some of the causes of sudden cardiac arrest in an infant. But again, they're really rare, and you know, I don't want you to worry. But let's talk about what would happen if something like that did occur. So I'm going to give you some scenarios just so that we can kind of act it out rather, but you know, don't worry that this is going to happen to your baby. So maybe we were looking at a baby in a crib, and let's see, it's just gone off again, but that's okay. Here we go. Am I back on again? No. Okay. I don't know why this has happened, but just to make it more interesting. So here's our baby in a crib, and you put the light on, and you look at the baby in the crib, and it's not moving, it's still. And so first thing that you do, like the adult, is to check the scene to make sure it's safe. You can't help a baby, a child, or an adult if you put yourself in some kind of danger. So you always check the scene, make sure it's safe. The next thing is to check the baby. And you remember with an adult, we kind of shut their shoulders. With a baby, we tap their foot. So baby, are you okay? And we talk to the baby, we stimulate the baby, we, you know, baby, are you okay? And this is a great way if you're a new grandma as well. We know when the daughter says, don't wake the baby, he's been up for hours, I've been up for hours, and then so you go into the baby's crib and you tap the baby and he wakes up. So that's a great grandma tip. Anyway, you do the baby, are you okay? No, you're not moving, you're still. That's not normal. You kind of got a funny colour around the lips. What's happening? Any unresponsiveness is a medical emergency. So if you're with somebody, perhaps there's a partner there, then you're going to say, call 911 right away, this baby's not moving. You're going to go back to the baby, you're going to look to see if that you can see any movement. If you know how to check for a pulse, do it. But we said that for every minute that we don't do something, the chances are reducing by 10%, so after 10 minutes. So, you know, don't spend time looking, you know, and feeling and listening and all of that if you don't know what you're doing. The best thing is to start compressions right away, because again, if this baby is sleepy, you know, by doing those compressions, you're going to stimulate him or you're going to move him. If you do want to check a pulse for a baby, you check on their brachial pulse. And a baby's pulse should be like 150. It should be really fast. And the same with the respirations. So even if you did feel a pulse and it was slow and you don't know if you could feel it, that's not enough to perfuse our baby. So there's nothing wrong. Better to give somebody compressions who doesn't need them than to not do anything at all. So with a baby, we're still looking for those same landmarks. We're looking on the lower half of their chest on the same line as the nipples. So again, better to view and to see where the landmarks are. We're not going to use this. We're going to either use our 2 fingers, our thumb, or we can do CPR like this. So I'll show you that in a second. So go through that again. The baby's not moving, he's still, something's not right. You just know in your gut, this isn't normal, he's unresponsive. Tell somebody immediately to call 911. Come back to your baby, couple of seconds just to scan the chest, see if you can see any movement. Is there anything going on? No, I need to do those compressions. So with our baby, we can use our 2 fingers. So we can do this. Oops, and it's just gone off again. So let me just come back. We can use our thumbs and do CPR like this, or we can use our thumb and go and do compressions like this. So again, it has to be hard and fast. You're not going to hurt baby. He hasn't got a pulse and he's not breathing. So you need to, you know, do good high quality CPR. You need to press that chest. You need to go at least 100 to 120 a minute. You need to go down at least 1.5 to 2 inches. Again, you know, that credit card. You do CPR on me and my ribs are, you know, you'd probably break something because I'm all crumbly and old. With a baby, they're really flexible, fragile but flexible. So, you know, don't go worrying that you're going to do some damage. You're saving this baby's life. So, and if you see somebody doing really pathetic, no, they have to be hard and fast and do good quality CPR. Remembering to, when you're doing that CPR, to, you know, make sure that you come off the chest to allow that recall as well. So, you know, we're doing that CPR. And now I said to you that, you know, the main reason why an infant would go into cardiac arrest is because of something respiratory. With an adult, you know, hands only is enough until paramedics and things arrive. But with an infant, are you going to hesitate in giving them mouth to mouth? Absolutely not. We want to increase their chances of survival. So with a baby, yeah, I don't care. I'm going to give, you know, mouth to mouth. It's going to give this baby the best chance. So for baby, when we do breathe into the baby, we put our mouth over their nose and their mouth. So you don't have to pinch their nose. You don't have to tilt their head. You just put your mouth over their mouth and nose. So there we go. Sorry. You're just going to do 2 short breaths and go back to the compressions. We said that the most important thing about CPR is the compressions. So don't waste time doing a lot of stuff with the mouth. Just give those 2 short breaths, enough to see the chest rise, and then go back to doing your compressions. So it looks something like this. You know, maybe you've got, you know, the finger thing didn't work. You felt like you're getting better compressions with the thumb. So you're doing those hard and fast compressions. And then you're ready to count. So 28, 29, 30. And then do the 2 breaths. I like to put my hand on the baby's head and then just enough to see the chest rise and then get straight back on the chest. It's not the biggest breath you've got, because otherwise the baby's belly and lungs will just fill up and it'll impede that CPR. So, or it'll impede that cardiac output. So just, you know, baby's lungs are tiny, so just need enough to see the chest rise. So you're just going to carry on, you know, 1, 2, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. 1, 2, 3. And when would we stop? When somebody taps you on the shoulder, I know how to do baby CPR, let me help, paramedic, EMT, nurse, doctor, first aider. I'm going to keep going. I'm going to keep going. And we're going to do everything that we possibly can to get this baby to breathe again. And with an adult, yeah, there's going to be a lot of other things, drugs and treatments, and, you know, outcomes might be more difficult. But with a baby, doing CPR, it can work. It can save the baby's life. There's a real chance that the baby might cough and splutter and start breathing again. So we're going to carry on until we see signs of life, until the baby moves, until the AD comes, or until the EMT people arrive. It's a scary thought to do CPR on a baby, but you can do it, right? Better to do something than to do nothing. And you can show your partners, your babysitters, your moms, your dads. It's a real easy skill to learn. But make sure you're doing it right, because things have changed, or people have myths, and oh, you do CPR in the belly button, don't you? Or what? Don't you do it like this? So, you know, if somebody's doing it wrong, or they're making a mistake, you know, we only get one chance to do CPR, so let's do it the best way that we can and do it right, and give our babies, children and adults the best chance of survival. So you can do the thumb, the CPR like this, or you can do the 2 fingers up until about a year old, and then maybe to 18 months, depending on the size of the baby. And then with a child to puberty, you could probably use 1 hand or maybe 2, depending on the size of the child. But always 100 to 120, 1.5 to 2 inches. Allow for recoil, so that means bouncing off the chest, allowing you know, that some space. Making sure that you do breaths for infants. How do you feel? Do you think that you, and I will send you some handouts, and there's another little video as well that you can watch. I'm sorry that we're not in the classroom, and we could have a bit of fun, and it would be, we could all have our mannequin and kind of learn together. But I hope that's giving you some ideas and some inspiration and confidence. So last thing is, we are going to talk about choking. So choking is the #1 cause of sudden cardiac arrest in infants. And as a mother of twins, yeah, I remember doing one of my babies choking on a piece of, I don't know if it was watermelon or something, and it didn't go down right, and I only had to do 1 back slap and out came, but it was scary. Not being able to breathe is the most scariest thing. So knowing what to do, and even prevention, right, is the key. So maybe you're in I was going to say McDonald's, but we don't eat out anymore, do we? But maybe you see a young mum or a grandma or a friend with their baby, and the baby is in the car seat, and they've had some, you know, maybe a little rice thingy, and they put it in their mouth, and they start to cough and splutter. So if the baby's coughing and making a noise, then that means that air is going in and air is coming out. So you could take that baby out of the you know, the chair, the car seat, you know, and just maybe put him on your knee and just keep encouraging him to cough, you know, and, you know, keep coughing, little baby, you're okay, because eventually he's just going to cough it out. But once our baby makes no noise, so he's gone from coughing and spluttering to nothing. He's still responsive, he's kicking his legs and his arms, and his little face is all pinched, and he can't make a noise, he can't get out whatever's stuck in there. Then we need to do something, because if a person can't breathe, their heart's going to stop and they're going to go into cardiac arrest. So, you know, maybe we see our baby, we see the baby's struggling, and the mom doesn't know what to do, or she's panicky or frightened, and she's, I don't know what to do with my baby. He was coughing, and now he's he's not able to make any noise, and I don't know what I should do. Sometimes I ask in the community, what have people done when that happens? And so sometimes people say that they did this, turn them upside down. The American Heart doesn't recommend that, so I'm going to teach you back slaps and chest thrusts. So here we have our baby. He's responsive. He was coughing, but now he's not making a noise and his airway's blocked. So the best thing that you can do is to tip your baby so that he's head down. So if he's kind of just level, that isn't going to work. He needs to be head down. Also, don't cover your hand with the baby's face. Kind of make a V so that anything that comes out, you're going to see. So head down, and then where you between the shoulder blades, and how you did CPR with the palm of your hand, you're going to do 5 back slaps. So 1, 2, 3, 4, 5. And this baby isn't unresponsive, so he's moving and he's heavy and he's protesting and he doesn't like it. So if you can kind of sit down, and then you can, maybe support the weight of your baby on your, your arm and your knee, so that, because, they're kind of moving around, and they're, they're not like this mannequin, they're, they're heavy. So, I've done this for my own child, one of my own children, and 1 back slap, and out came, the the stuff that had blocked their airway. So don't worry that you're going to hurt little precious, or they're not able to breathe. You need to be firm. So 1, 2, 3, 4, 5. Turn them over. Have a look at your baby. See if you can see anything. If you can move it, do it, but don't put your finger down, because you just push whatever's blocking the airway further down. So if they're still they're still struggling and there's no noise, then you can use your 2 fingers, and between the nipples, you can do chest thrusts. So 3, 4, 5, and then turn your baby over and do 5 back slaps. Again, it's going to be quite rare that after you would need to do both. Usually 1 or 2 back slaps, out it comes. The baby cries, you cry. It's going to be okay. The only thing I would suggest is, if you ever had to do the back slaps or the chest thrust, it's always great to get somebody to look at the back of the baby's throat. Their anatomy is really small back there and can swell. So if they've had a traumatic time, it might be a good idea to check in with your healthcare provider, or just to make sure that everything's okay there. While and this isn't going to happen, but we'll do this scenario anyway. What would happen if you were doing the back slaps and the baby had been kind of wriggling, and and then suddenly went still? This baby isn't moving. You turn that baby over, you look at that baby, and do you remember how we stimulate the baby? So, baby, are you okay? With his foot, he's not moving, he's unresponsive. Always a medical emergency. So you're going to call your partner, you're going to say, you in the green shirt, call 911. You're going to come back to your baby, still not breathing, moving, looks blue. I've got to do something. I'm going to do CPR. So do you remember how we do that? We're going to either use our 2 fingers, our thumb, or we can put our 2 thumbs together and do CPR like this. We're going to go hard and fast. We're going to go at least 100 to 120 compressions a minute. So that's 1, 2, 3. You can do it with those 2 fingers. You can do it with the thumb. 1, 2, 3, 4, 5, 6, 28, 29, 30. We're going to do those 2 breaths. If they're choked, maybe the breaths won't go in, the airway's blocked, but we're still going to attempt it. So I'm going to put my mouth over their nose and mouth. then I'm going to go back to doing those compressions. 30 compressions, 2 breaths, 30 compressions, 2 breaths. If you were completely on your own, you can put your cell phone on speaker and the dispatcher will tell you everything that you need to do, and they'll go through it with you, and nothing will be delayed. They know your location, and you know the paramedics will be on their way. But what if you haven't got a cell phone? You didn't charge it up. You're on your own. With a child or an infant, it's always worth doing 5 cycles or 2 minutes of CPR before you took your child or your baby to the front door and yelled for help. So with an adult, I said, if you're on your own, you've got no cell phone, you walk in the lake and you found somebody down, then it's better to leave them and go and get some help, because you haven't got a cell phone, there's nobody around. But if you're on your own with a baby, it's worth doing 2 minutes of CPR, because it can actually be enough to bring that baby back and start that chain of survival, before you grab your cell phone or go tell the neighbour in the garden next door to come over, or do whatever to get some help. So I hope that's clear for you. Oh, I've just got a question on there. I'll have a look. How do you feel about baby CPR and baby choking? Do you feel a bit more confident? Do you think you would be able to do it? Yeah. Whatever you do is better than doing nothing. And the more you learn, or even just having to go with a pillow and the toilet roll, or just talking about what would happen if, or I think that this is a really rare thing to happen, but kind of like all your baby things, put it in your file and you've learnt it, and what a great skill to have. So that kind of brings me on to the last couple of minutes here. I did want to show you an AED, so automated external defibrillator. We do use them on babies and children. It's going to be quite rare that they would use them, or need them, I should say, but they're definitely, when paramedics come, they would put the AED on. Great story in the newspaper just a month or so ago about the customer who went down in Fleet Farm, and the store assistant and a bystander started CPR, hands-only CPR, got that going. The dispatcher said, have you got an AED? He said, well, there's one in the store, so somebody went to go and get it. They'd never used it before. They put it on that person and shocked that adult with the AED, and they survived. And I could tell you other stories, amazing things that have happened in Winona when people have used an AED. But I guess you need your supper and you need some downtime. But they are amazing. So if you have an AED in your workplace or your church, or maybe you just kind of want to know how they work, I would be happy to come to your workplace or do a little thing on AEDs. They're in public places so that the public can use them. Teach 8th graders how to use them. They're all easy. You can't do anything wrong. They don't shock anybody by accident. So why we use them is when a heart's electrical system is all kind of out of sync. So what I mean by that is if the heart is wobbling like a bowl of jello, it's called fibrillation. You might have heard that word. So the ventricles are fibrillating. They're shaking like a bowl of jello. They're not pumping the blood and oxygen around. And what the AD does, you put it on the chest. They find out if there's a heartbeat or if there isn't, or if the heart is fibrillating, shaking like a bowl of jello. And if it is, the AD sends an electric shock of, I don't know, maybe 120 joules, and it stops the heart, and then hopefully the heart's going to restart again. And sometimes it takes 2 shocks, 3 shocks until that heart starts beating normally. So the good thing about this AD is you could put this AD on me right now, and because I've got a pulse and I'm breathing, it's going to say no shock. So we just carry on doing CPR, and because, you know, I don't know why my heart stopped or whatever, but you know, if the person's got heartbeat and breathing, it's saying no shock. If the person is dead, you know, and they haven't got heartbeat and you know, they died in their sleep or something, it's not going to bring them back. It will say no shock. The only time it will give a shock is if that heart's quivering like a bowl of jello, so those ventricles are all shaking and need to stop. So it's going to be quite rare that a baby or a child would have fibrillation, because, you know, it's the thing that comes with age. But you know, because we said that if there's some kind of congenital thing, or then they will absolutely try it. So you can use an AD even if you've never used one before, because it's voice prompted, and they're easy to use. Just show you quickly how it works. There's a button that says open. So this is just a trainer. So it's like all AEDs work the same. Different models, you know, might look a bit different, but they all work the same. So you open it up.
Call for help now. Remove all clothing from patient's chest.
So I'm going to use my baby. You can use an AD on a baby.
Pull red handle to open bag.
So I'm going to open this bag, and then it has some patches.
Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Do not touch patient. Evaluating heart rhythm. Stand by. Preparing to shock. Everyone clear. Press flashing button. Shock delivered. Provide chest compressions and rescue breath.
So I have my patches on my baby, and I'm going to do the CPR. So how many compressions? 30. And we can use your thumb, or we can do it like this. 30 compressions and 2 breaths. And
continue care.
Then after 2 minutes, it will reanalyze again. So it has to be skin to skin. With an adult, you put the patches on as it shows in the picture. If you put the patches on wrong, it has a chip in there and it will say patches not correct. So you can use adult patches for baby, child, or adult. In some child and daycare infants, they might just have patches for children and infants, but then you wouldn't be able to use them for an adult. So that's kind of a bit confusing, but an adult patches you can use for an infant, child, and adult. Infant and child patches you can't use on an adult. So that's why in the community they're all adult patches. So when it's analysing, it's looking for a heartbeat, and if there is a slight heartbeat, no shock. And if the person is dead or hasn't got heartbeat, it's going to be no shock. It's only when that heart, all those ventricles are fibrillating. So you just every 2 minutes it reanalyzes, and we keep going with the CPR. And if you use an AD and maybe it doesn't switch on, or it can't, you don't have to work it, leave it, just carry on, because the most important part of CPR is you doing the compressions. And every police car, fire truck, ambulance has an AD. So yeah, contact me if you want me to look at your AD, and I'll come over, free, nothing, and we'll just look at it, and I can help you to use it. So hope that was helpful. I will be sending you some information about prevention, and the handouts that I have for you, I'll just go through quick. Let me just see here. Okay. So the handouts that I have will be some hands-only CPR, some infant CPR, a first aid kit for a baby. What a great present for a shower, or a shower present, or just for prepping for when you have a baby. You go to Walgreens and they're fine, but they haven't got anything in that you need. So a really good list to keep in a tub for your first aid kit. Also a handout on when to call the doctor, when to go to the urgent care, when to go to the emergency room, those sort of things. Also, how to get your free baby box. There's a group in Minnesota that are encouraging new parents to put babies in a smaller crib rather than taking them into their bed, or promoting baby boxes, and you get some great free bits and pieces as well. And the last thing is information about baby sleeping safe and putting baby on their back. So look out for those and print them off if you're interested. I will also be encouraging you to make a couple of cards for your first aid kit. One in case of emergency with all phone numbers, because if you're like me, I don't know everybody's cell phone number, and when you're a little bit stressed and anxious trying to remember phone numbers, so that's great in case of emergency. And then just making a little card for your baby, allergies, medication, and pertinent medical history, just with things on like meds, surgery, birth weight, if they've had any vaccinations, that sort of thing. Because if you ever had to do anything with your baby and then the paramedics come and your brain's mush, and you can hand over those cards, and I think that would be really helpful. I see I've got a few questions in the chat box, so I'll just have a quick look at those. Otherwise, it's nearly 7 o'clock, and I'm sure that you're ready to. At what age does the infant CPR stop, and you would start doing the adult age CPR on a child? So probably said maybe to 18, from birth to maybe, depending on the size of the baby, but neither's wrong. So, as long as you're doing effective CPR, so a child, could be considered a 2-year-old to puberty. So I hope that answers your question. For toddler over 2, what is the breath compression ratio? Great question. It's always 30 to 2. For bystanders, we're always going to go 30 compressions to 2 breaths. If you're certified and you've done courses, that might be different. But for the community and for bystander CPR, if you do, if it's a loved one and you don't need a mask and you're willing to do the mouth to mouth, then it's whether you're 101 or you're just born, it's going to be 30 compressions to 2 breaths. Let's see. Oh, I think, yeah. Oh, great. Well, you can always email me as well if you have any questions. I'm happy to help. I'm sorry it hasn't been great with the technology, but hopefully you managed to follow along and have learned and feel a little more confident about infant CPR. I'm sorry I can't get to know you. Usually in the class, you know, we bring babies and partners and babysitters, and it's kind of fun and we learn as well. So thanks for sticking with this, and maybe I'll see you in the community. And enjoy your babies, because I know I'm really enjoying mine. And take care, everybody, and hopefully we'll be meeting in person soon.